Every day in our communities, thousands of innocent victims, regardless of age, gender, race, and socioeconomic status, experience abuse. The numbers are almost too much to comprehend. In the United States, a woman is sexually assaulted every 2 minutes. 4.7 million women experience physical violence by an intimate partner every year. More than 400,000 children and adults are sexually abused. More than 5,000 human trafficking cases were reported in 2014. Too many of these victims are left untreated and unattended. Too many perpetrators go free because the evidence is improperly collected. And because a frightening visit to the emergency room can, for many victims, be as traumatic as the assault itself, many feel victimized a second time. Not at Bon Secours. For decades, Bon Secours has become a vocal leader and fierce advocate for victims of all manner of abuse. In 1993, forensic nurse Bonnie Price worked with Bon Secours to develop the Forensic Nursing Program. Today, the program is a 24-hour-a-day, 7-day-a-week operation with 10 full-time forensic nurses. The program serves 23 different jurisdictions across the Commonwealth. No victim of sexual abuse, assault, or domestic violence is turned away. And instead of devastating, the hospital visit can be empowering to victims of abuse.
Our patients always present through the emergency room, but our goal is to get them out of the emergency room as quickly as possible. And the reason for that is, one, the ER is a very noisy, busy environment. The privacy sometimes can be a little less than what we would like. So we remove them immediately as soon as they're medically cleared out of the ER to our office, which we have a suite. We're very blessed. We have a waiting room. We have a room that we actually interview our patients in. We also do child interviews in there. And then we have our exam room. It's a locked unit. No one can come up there. It's not even very well marked for that specific reason. It's a very safe place.
The conversation that happens inside forensic nursing's safe haven is a first step in a larger effort to gather evidence that can ultimately land a perpetrator in jail and begin the healing process for victims. Since its inception, the Forensic Nursing Program has helped thousands of abuse victims through this process. In 2014 alone, the Bon Secours Forensic Nursing Team handled nearly 2,000 abuse-related calls, a 49% increase from the previous year. More than 1,000 of those calls resulted in actual cases, and our forensic nursing team collected 149 physical evidence recovery kits. This vital physical evidence is collected by nurses with advanced training in this area. Their specialized skills have a significant impact on police cases, investigations, and convictions.
It's really twofold. It gives us a lot more credibility in court. So when we're presenting our information that we receive from the patient, whether it be their history or the findings that we had on the exam, when we can say we've gone to school, we're certified in this area, it gives us a great deal of credibility with both the judge, the jury, and even the people that we serve, so law enforcement, child protective services. You know, there's a lot of patients that go into an emergency room and they'll either have an ER nurse do their exam or an ER doctor, and it may be the one case they've done in the last 5 to 10 years, whereas we're doing it 24/7, and we're able to use that knowledge that we gain every day. We're one of the first programs in the country to start doing touch DNA on strangulation victims. So if you come into the hospital, you say that you were strangled, most people will come in and say that they've been choked or some other form of that description. As long as that patient hasn't been touched by another male provider, EMS provider, firefighter, whoever it may be, we can then collect evidence from their neck for DNA purposes, which is huge. We have been supported from Bon Secours to then bring those patients back in about 72 hours, and we do what we call a follow-up exam. So we're gonna remeasure their neck, reassess their vitals, make sure that they don't have any injuries at that point, because the bruises may come up then, or the other red marks may show up a couple days later. So we bring them back and re-photograph them.
Bonnie's work in transforming the methods used in hospitals to treat victims of abuse has attracted local and international attention. Last year, Bonnie was named one of Richmond Magazine's top docs and received the highest honor in her profession for contributions to the field. To the nurses on her staff, Bonnie serves as their mentor and teacher.
I'm extremely proud of her. It's really been a pleasure and a blessing to work for her, and like I said before, I wouldn't be where I am now without her support, which makes a world of a difference to feel that supported when you're doing the kind of work that we do.
We are making a difference here, and you can help us continue with this pioneering effort to support and protect victims of abuse and violence in the greater Richmond area. Funds raised through Wine, Women, and Shoes will purchase equipment such as a $25,000 colposcope, a specialized microscope and camera system that allows for more precise evidence collection. Your donations will help maintain the high-quality camera equipment needed at each Bon Secours facility. Your gifts will assist forensic nurses as they pursue continuing education and implement the latest techniques to help victims of abuse.
To have a forensic nurse who's highly trained and dedicated to take care of only these patients. They don't do ER, they don't do anything else. When they're on duty, their sole focus is the care of people who've been victims of violence. I think that's what makes us very unique.
Every gift enables Bon Secours forensic nurses to pursue and put into practice proven methods to better collect evidence and help victims survive the worst day of their lives and find better days ahead.